So today we are starting with the practicals 2.0 of the FARRE, and we are going to focus on the exercises, right? The practical exercises. We're going to cover all of them. So we are going to look at the important staining techniques, all the potential important viva questions which can be asked, and then we are going to go on to the culture exercises. What particular plates you can get, what is the history you can get, what are the important things that you have to write. We're going to cover all the important 8 organisms that get asked in almost every university exam. Okay, so these 8 organisms we're going to discuss, and then we'll move on to Zn stain, all the possible potential questions of Zn stain. We'll look at the NTEP gradings, we'll look at Lepre gradings also, and all the possible googly questions. Then we move on to Albert stain, and so on and so forth. If the time allows, we will discuss a bit about donning, doffing and all of that. Otherwise, I'll share the PDF with you. Okay, good evening, good evening. So excited to see you once again. Karthago Waterbury, please let me know how to pronounce your name, since yesterday I've been struggling. Good evening, Saivi. I have just told you what all topics we are going to discuss today. We are going to discuss all the practical exercises. We are going to discuss gram staining, all the potential questions. We are going to discuss all the 8 microorganisms for which you get the big culture exercise, the 20 marker or the 30 marker. We will discuss Zn stain, Albert stain, and then if the time allows, we will discuss stations such as donning, doffing of PPE, hand hygiene, movements, and a little bit about biomedical waste management if the time allows. All right. So let's not waste any time. If I ask any questions, let's try to answer quickly. Otherwise, we'll just go ahead. Okay. So I'm going to start with the gram staining. Gram staining is one thing which you have to. Yesterday lecture was awesome. Thank you so much, Saivi. I'm so glad that you liked it. The purpose was that it becomes useful for you guys. I've tried to incorporate maximum things within 2 hours so that you can, quickly watch it and revise right before the exam as well. ठीक है? So चलो. So हम gram staining की बात कर रहे हैं. सिर्फ whitey chart रहने दो. Excellent. चलो. So gram staining is something जो आपके 2 तरह से पूछा जा सकता है. First of all, you have to perform gram staining as a part of the culture exercise. ठीक है? आपको एक culture plate मिलती है, एक associated clinical question मिलता है, and you are asked to write it, right? Then another way in which you can have to do gram staining is the performing stations, because in the CBME you have observation stations and performance stations, etc. Right? So there you might have to perform the gram stain. So either the examiner can watch you perform it silently in an observation station, or you might get a culture plate where you have to perform the gram stain on your own, and the examiner is just going to finally come and look under the microscope at what you have performed. Or the examiner can come and ask you the steps step by step, and each step having half a mark. So these are all the potential possible formats of university exams of microbiology, depending upon the university and what curriculum is being followed. Most of the universities are following the CBME curriculum, barring a few aims. Over there, still the exam is, I don't know about this year, but yes, until last year that was the case. Anyhow, the syllabus remains the same, the skill required remains the same. Okay. Thoda sa screen par. Right? Okay. Yes, so let's start with gram staining. देखो, किसी भी staining से करने से पहले, whenever the examiner asks you the steps or etc., the first thing that you must remember always is to tell that Waterbury, okay, I'll call you Waterbury, excellent. The first step before performing any staining technique is actually smear fixation, okay. So you must always start your answer with smear fixation. Okay, do not forget to mention this if the examiner is asking you, or you are performing and it's an observed station. What is smear fixation? You have taken a glass slide. On that glass slide, you have made an emulsion of the colony of the bacteria. What are you going to do? Suppose you get a culture plate like this, okay. You are probably going to get a culture plate like this. So please identify isolated colonies on this culture plate. What do I mean by isolated colonies? I mean this one single colony which is lying here, this one single colony which is lying here. One unsolicited advice, unasked advice, one thing which I have learned from my experience, which you're not going to find in absolutely any book on this earth, is that try to not pick the colonies from the corners of the plate, because most of the time in the corners of the plate there are environmental contaminants. Depends upon how seriously the resident of your college has, cultured the plates and all. So try to avoid picking up the colonies from this side. This is an exam hack, like a senior I'm telling you. Always try to find the place where there is this, all of these colonies together. Okay, and now you know that, okay, this is at least the purest part of this culture plate. Here there is no mixing happening. Now from this, just take your loop or your straight wire and just about touch a singular colony. Okay, do not do a sweep of the colonies. Then your entire fields get filled up with so much bacteria that it's very difficult to tell the arrangement. That is why most of the time when you make a slide of Streptococcus, you cannot appreciate the beautiful long chains. Why? Because everything has gotten gachpach, everything has gotten, jumbled up together on that slide. So, okay, let's not blame the examiners right now. Right. So this here, you see this particular colony. So what am I going to do? I'm going to just take a straight wire or a loop and I'm just going to touch it. Just touch it and remove. It is enough. Don't try to pick up something which you can see with the naked eye. Please always remember, these bacteria are microscopic. If we have that psychological effect of, oh, I have not picked enough, I will pick up like this so that I can see it, then I'm making a nice emulsion which is looking like a thick white milk. Please don't do that. That is a lot of colony you have picked up. Okay, so this is extra advice which I am giving you from my life experience. Just pick up this one, touch the colony and go away. Many central university examiners, they also ask you this question sometimes, because this is something that can never be learned from books. This is only learned by going to the practical halls. So I have bypassed that process for you. Okay, so you have just picked up a singular colony and you have put it onto a glass slide on which you had 1 drop of normal saline. Now you made an emulsion of it. You have a nice coin-sized emulsion. Okay. So they ask you, what is an ideal smear? An ideal smear is one which is a penny-sized or 1 centimeter by 1 centimeter square, or a 1 rupee coin-sized smear. And when you heat fix it, what is smear fixation? You heat it from the bottom on a Bunsen burner so that it is fixed. Okay. How does it look fixed? You will see opacity starting from the periphery and coming onto the center. So if suppose this is your slide, this is your glass slide, okay, or ispe you have made this smear. You have made this smear which is about 1 coin size, 1 centimeter by 1 centimeter. What will happen when you will heat fix it? You will see that from the corners it will start to turn opaque, and as you keep heating it, the opacity will move towards the center, and finally there will be a time when it will be totally opaque. Now at this point you know that your smear has gotten fixed. Okay, and when you put a paper with something written on it behind this, okay, you can just about read the things which are written. You cannot clearly read it. You cannot clearly read it, but you can just about appreciate the written material from behind the smear. So these are the qualities of a good smear. All right, chalo, ye baat ho gayi. So the first step is always here, smear fixation by heating. What does smear fixation do? It coagulates the bacteria onto the slide. So now your bacteria has stuck onto the slide. It is not moving about anywhere. So now when you're going to pour all the stains and water and flood the slide with so many liquids, the bacteria is not going to get washed away. It is going to stick to the slide and then you can easily stain it. Okay, the bacteria dies, the proteins in the walls, they coagulate and they stick to the slide. These are the things that you say why smear fixation is needed. After that, you have to do something which is called as the primary stain or the primary dye. Then you put a mordant, right? Then you put a decolorizer, and then you put a secondary stain. Secondary stain is also called as a counter stain. Why? Because it is countering the primary stain, meaning if my bacteria has taken the primary stain, then the secondary stain is going to counter stain the background. Okay, or if my bacteria has not retained the primary stain, then the secondary stain can come and act as a counter. Okay, so it is also called as a counter stain or a secondary stain. Okay, so primary stain is mostly crystal violet. Crystal violet is the stain which is used primarily. The mordant which is used is a chemical mordant, which is iodine. So the question which arises right here is, what is a mordant? A mordant is anything which helps in better penetration of the stain. Okay, it helps in better penetration and retention of the primary stain or the primary dye. Sometimes they ask you a question, what is a stain? Okay, and we are just flabbergasted at that moment that what is this examiner asking me? What is a stain? A stain is nothing but a chemical dye. It can be a basic dye, it can be an acidic dye. One example of a basic dye is crystal violet, methylene blue. These are all basic dyes. Okay, one example of acidic dye is your saffronin, etc. Right? So anything which helps the primary dye or the primary stain penetrate better inside the bacterial cell wall or get retained inside the bacterial cell wall, that is a mordant. What are the classifications of mordant? A mordant can be of two types. There can be a physical mordant and there can be a chemical mordant. So this iodine that we have looked at is a chemical mordant. A chemical mordant is the grams iodine. Which iodine? Grams iodine is a chemical mordant. Okay? Then we have physical. Physical mein kya hai? Example, heat which we use in Zn staining. In Zn staining, the heat which we use is an example of a physical mordant. Okay, simple ho gaya. Now you know that mordant is the iodine. Why is it a mordant? Because when you have added the primary stain onto your bacterium. So let's see what is happening to the bacterium. This is here a colorless bacterium. Okay, you added the crystal violet. So now what will happen as a result? As a result, this bacterium will turn purple. Any bacteria, irrespective of whether it's a gram positive or a gram negative bacteria, it is going to turn purple. Okay, so let's look at two types of bacteria over here. So let's look at two guys. One is this guy, one is this guy. So when we put the primary stain, both of these guys, they ended up taking the gram stain, okay, the crystal violet. Now both of them are blue. Then what is the next step you did? You put this for how much time? You put this for around 1 minute. Okay. For 1 minute, oh God, what is happening? Sorry. See, so for 1 minute, you have put the primary stain, which is crystal violet. Then you are going to add as a second iodine. Iodine is going to create big complexes with this crystal violet, right? So here is a molecule of crystal violet and here is a molecule of iodine. So together they are creating what? They are creating big complexes. Big complexes. Now, one of these guys is going to now still both of them are what? Both of them are still blue because they are still carrying the primary stain. Then you do the most important step. Now you are going to wash it. Wash. Now here's a controversy. Many people in many institutes say that you should not wash after the crystal violet. Okay. But in many institutes, they say that you wash after crystal violet. So please go by whatever your university says, whatever your resident doctors have said, whatever your HODs and your professors believe. Okay. Because this is the biggest controversy ever. Do you wash after crystal violet or do you not wash after crystal violet? I will tell you the argument which is given for and against both. So the people who are who believe that no washing should be done after crystal violet believe that since iodine has to act as a mordant and these big complexes have to be created. So if you will wash right after putting the primary dye, you have washed off the primary dye. Now how will the complex get made? So you are going to get a bad gram stain. Okay, it is going to be poorly gram stained. Then there are the other group of people which say, but your bacteria is microscopic. Okay, when you have put the primary dye, you have kept it for 1 minute, it got enough time for that primary dye to penetrate inside the cell wall. And now once it is inside the cell wall, if just water is not going to wash off any color. For washing off the color, you need a decolorizer. Okay, so just see what gets you the best results in your labs, because every lab stain composition, chemical composition, the method in which the lab technician has made the stains, so many things it depends upon. So if in your college with the equipment you have got, washing and then putting iodine gives you a good result, go ahead, no problem. But if in your college you feel that okay, washing gives me not such a good result, then don't wash after primary stain. Okay, so you put primary stain, you wash or not wash, what is important is you add iodine, which is a mordant. Now what has happened is, in some bacteria this stain is going to stick nicely inside the cell wall, but in some bacteria the stain is going to remain loosely. Now comes the most important step of any staining technique, which is the decolorization step, which is the most important step in the whole process. Sometimes examiners ask you this viva question, which is the most important step? It is the decolorization step. Okay, what do you decolorize with? Either with acetone or with acetone alcohol. So depending upon what your college offers you, it could be acetone or it could be acetone alcohol combination. Okay, so what is the decolorizer going to do? It is going to bring these complexes out of the cell wall. Okay, extract them out of the cell wall. Now again there are these two guys. Okay, so what happened in one guy, these big complexes, they could not come out, so this guy remained blue. Whereas this other guy, upon adding alcohol, he left his blue stain. Okay, so he left his blue stain. This blue stain came out of the cell and now this guy has become colorless again. Okay, so for how much time do you put acetone or alcohol? Hardly 2 to 3 seconds. Hardly 2 to 3 seconds. So immediately, so what are you doing? You're taking a slide, you're fixing the smear first. First you make the smear, put a drop of normal saline, just touch a colony, make an emulsion, put it onto heat. Don't burn your hands, don't break your slide, don't crack your slides. Okay, just pass it through the flame quickly so that it gets fixed. You've seen how fixation happens, how the opacity moves. I've shown in one slide behind this how the opacity moves. Once it is fixed, you pour crystal violet, wait for 1 minute, you pour iodine, again you wait for 1 minute. Okay, so for iodine also the time is 1 minute. Then you put your acetone or acetone alcohol, and the moment you put acetone alcohol, you immediately wash it. Okay, immediately wash it. So because hardly 2 to 3 seconds it has to be put, and then you put your counter stain saffron in red for around 30 seconds. Okay, for around 30 seconds, and then finally you wash it, then you air dry it, and then you focus at 100x oil immersion lengths. Okay, then you focus at 100x oil immersion lengths. Now what is going to happen when you added the saffron in red? You still had these two kinds of bacteria. Yes, this guy already had a lot of blue color inside. There is no space for this red color to come. But this guy, which had become colorless, now he has all the space to get the red color. So that is why in the final result, what do you see? You see that some types of bacteria, they stain blue, whereas some other types of bacteria, they stain red. So what is the differentiating point between a gram stain and gram negative? What is the thing that makes a gram positive or gram negative? It is the decolorization step and the mordant step. Okay, it depends upon the type of the cell wall. Okay, it depends upon the type of the cell wall. If I have a gram positive type of a cell wall with a very thick peptidoglycan, which is very complicated and interconnected, can you tell me why is it complicated? You remember the nam-nag sequences of the cell wall and the tetrapeptide side chains which were dropping from the cell wall. Those tetrapeptide side chains in the gram positive were joined by the pentaglycine bridges. Remember, Pagla, LD are mnemonic. So P was positive and P was pentaglycine side chains. Now these pentaglycine side chains is what is making it very complex, and you know that gram positive bacteria are gram positive because they have a very thick peptidoglycan. Now this big complex of iodine and crystal violet, you know, crystal violet is a crystalline dye. It is made up of crystals, and iodine also crystallizes along with it. Now these big crystals, they get entrapped in between the complex and thick peptidoglycan layer of the cell wall of gram positive bacteria. That is why when you add acetone, these big complexes are not able to come out. जैसे net में मछली फंसती है, the way a fish gets caught in a fisherman's net, in the same way, this big iodine and crystal violet complex is stuck inside the thick and complicated Okay, there was static. In the peptidoglycan layer of the cell wall of the gram-positive type of bacteria. Okay, that is what I meant to say. Now, what happens in gram-negative? Gram-negative have a very thin peptidoglycan, okay, and they have another thing which is very important is the pore-in channels. So, from their pore-in channels, these iodine and crystal violet complexes are able to come outside. They are able to pass outside. So, that is why gram-negative type of bacteria, they lose their primary color upon adding acetone, but the gram-positive bacteria, they retain the primary dye despite putting the decolorizer. And finally, when you put the counter stain, there is no space in the gram positive for the red to come, so they remain blue. Guys, that is the difference. Gram positive bacteria don't stain blue and gram negative don't stain red. The gram positive remain blue, whereas the gram negative, they take up the red stain because they have now become colorless. Love your teaching and mnemonics. Thank you so much, guys. First year, Prof. Biochem important. Yes, of course, you're going to pass. See you in a few months. Go and study very hard for first year. Love you too, Amal. Thank you so much for your kind words. Chalo, theek hai, let's go back. Right? So, I hope now the concept is grilled into your brains. Really, you know, I have grilled it in. Please remember, most important step is decolorizer, and that is the mechanism. And the timing is very simple. 1 minute, immediately, and 30 seconds. These are the timelines in which you have to perform gram stain, right? Ultimately, what is the result that you will achieve? Ultimately, you will achieve this. So, depending upon what is the shape of the bacteria and what gram reaction it has taken, you can either get some gram positive cocci in chains, you can get some gram positive cocci. Now you have to comment on their arrangement, whether they're arranged in clusters, whether they're arranged in chains, whether they're arranged in pairs. Okay. Then you can have some gram positive bacilli, you can have some gram negative bacilli, and you can also have some gram negative cocci. What you're going to get in exam mostly always is a gram positive cocci or a gram negative bacilli. End of story. Right? They're not going to give you any other thing. Oh God. Guys, just a minute, please excuse me. All right, so let's hope that we have less static now. Fine. So let's get back to it. What was I saying? Yeah, so it is very unlikely, almost impossible. They will never give you a gram positive bacilli or a gram negative cocci. What they will give you? They will always give you a GPC or a GNP. All right. Yes, I'm coming on to the modifications. I'm coming on to all the possible Viva questions. Please wait. This is all the possible Viva questions and modifications that we are going to discuss. Okay? Chalo. So now the most important thing that I want you to understand now is how to write your answer in the exams. Okay? Many students, the moment they have any of this formation under the microscope, they straight away write. They just see GPC in clusters and they write, oh, this is Staph aureus. Then the examiner comes, examiner says, how do you know? Then the argument starts, and then I get the messages, ma'am, my examiner was rude, my examiner had attitude, my examiner was stupid. He said, oh, you don't know, this is Staph aureus, but I know this is Staph aureus. See, it's all about presentation, right? Examiner tells you that you cannot just jump to the conclusion that this is Staph aureus just because you're seeing some GPC in clusters. Okay, so that is why you have to go through a proper way of saying and writing the things in the exam. You have to first write the observation and then write your interpretation. This is the exact format in which you should write these answers of gram staining in your answer sheet. This is the format in which you should also speak up the answer in front of your examiner. Okay, what is your observation? Means what is the exact thing that you're observing under the microscope. You are not looking under the microscope and the bacteria is not screaming out, I am Staph aureus. No, that is not happening. When you're looking under the microscope, all that you're seeing is some blue colored cocci which are arranged in whatever arrangement. ठीक है? इसके अलावा तुम्हें कुछ observe नहीं हो रहा है. The fact that you know that this is a Staph aureus is your interpretation of that observation. That is not your observation, all right? Okay. I will, for which parasites? Okay, that's an interesting question. So yes, okay. So probably they wanted to say microsporidia, which are now being considered as parasites, which were earlier considered as fungi. So your sporozoans and especially your microsporidia can take up the gram stain also, right? So that is probably a googly question that the examiner was asking you. The point that they're asking you this question itself goes to show that your viva was going very, very well, waterbury. ऑलराइट चलो, तो अब आप ऑब्जर्वेशन क्या लिखोगे अपने, आप लिखोगे कि एट 1000 times magnification. Do you realize? Because you have focused the slide at oil immersion lens, and the power of oil immersion lens is 100x, and then the light comes through the eyepiece lens. The eyepiece lens has further 10x, so 100x into 10x becomes 1000x. So you're looking at something 1000 times magnified. Okay, so this is at 1000 times magnification. I can observe blue colored, blue or you can say purple cocci approximately, जो भी उनका size है. Okay, if you're looking at Staph aureus, approximately 1 micrometer in size. Okay, arranged in, जो भी आपको दिख रहा है, clusters दिख रहा है, chains दिख रहा है, pairs दिख रहा है, whatever you can see. Now examiner will ask you, how do you know that this is 1 micrometer, right? So what do you say? You say, sir, I need to ask for a control. Okay, you will ask for a control, GPC control. If they do not give you a control, then you can choose to not write the size also. Okay, so depends. You ask the teachers, can I get a positive control from my slide? So you take the slide, you divide it into 3 portions. Here you put a positive control, here you put a negative control, and here you put your test organism. So most likely your table teacher will give you a Staph aureus for a positive control and an E. coli for a negative control. Positive control means gram positive, negative control means gram negative. So you are taking a known strain. You know that this bacteria that the lab attendant is giving me is a Staph aureus. So when I will perform my gram staining, this guy should stain as GPC, and this guy is E. coli he is given me, so this guy should stain as GNB. And then depending upon what organism you have gotten, if you have got Staph aureus, your test should look exactly like your control. Okay, now some students were messaging me that, ma'am, my staining was dull, my staining was like this, I got a lot of dart, etc. If you will put controls on your slide, there is no scope of any dart from the examiner, because then you can show them that whatever steps I have performed, even your lab controlled Staph aureus is also giving me the same morphology as this Staph aureus which my plate has. Okay, so it might surprise your resident doctors, it might surprise your lab attendant that at UG level you're asking for a control. But if you are somebody who has faced this controversy in something as simple as gram stain, that the examiner comes and tells you, oh, you have not done it properly, the other guy has done it properly, but you have performed all the steps, at that point if you ask for controls, that controversy gets out of the window. Okay, goes out of the window. And then when you have put a gram positive control, then you can say that I know that this positive control is Staph aureus, and I know for a fact that Staph aureus is 1 micrometer in size. And when I look at this part of the slide where I have smeared the positive control, and then I look at this part of the slide, then I can see that the size is comparable. The size of bacteria in my known positive control is equivalent to the size of bacteria in my test slide which I have made from the plate that you have given me. Okay, so that is why I can say that this guy is 1 micrometer in size. In the scenario where you are not putting a control or you have not been provided a control, in that scenario don't comment upon the size. Simply comment upon the shape, which is that it is cocci or bacilli or anything, and simply comment upon the arrangement, whether they are in pairs, clusters, chains, or singly. So it could be blue or purple or red, cocci or bacilli, depending upon whatever you're seeing, whatever specimen you have been given. You can write this observation. Then you will write the interpretation. What is the interpretation? That I can see gram positive cocci in chains, or gram positive cocci in clusters, or gram negative bacilli arranged singly. This is going to be your simple interpretation. You do not utter the word gram positive or negative in your observation. That is your interpretation. That is your understanding that the things which look purple are gram positive and things which look red are gram negative. All right. So with lots and lots of intense discussion about gram staining, I don't think there is anything left anymore. This is the way your examiners think, imagine, understand, and that is all that they're going to ask you. ठीक है. फिर आपकी gram stain में they ask you what are the theories of a gram stain. So there are many theories of gram stain, which is the pH theory, the lipid content theory, and the cell wall theory. Out of these theories, the most acceptable and the most appropriate considered till days is the cell wall theory. It's the most acceptable theory. Okay, cell wall theory is the most acceptable theory of all. ठीक है. pH theory क्या है? pH theory says that the acidic cytoplasm of gram positive bacteria, acidic cytoplasm of gram positive bacteria take up the acidic primary stain. Okay. Then the lipid content theory says that gram negative have lots of lipid in their cell wall, right, which dissolves upon adding acetone. Therefore, they leave or drain out the primary stain, right? So this is pH theory and lipid content theory. But what is cell wall theory? The most accepted of all. What is it saying? It is saying that the gram positive type of bacteria have a thick and complex peptidoglycan layer in their cell wall, which retains the big complexes of crystal violet plus iodine, therefore not decolorized. Okay, that is the cell wall theory, which is the most acceptable theory of all. ठीक है ना, हो गया. Now modification, somebody was asking me modifications of gram stain. You have to know of two major modifications. One is called as the Brown and Bren modification. Another is called as the Jensen's modification. So what is Brown and Bren modification? In Brown and Bren modification, you use carbamazepine and you do it for actinomyces. ठीक है. Who do you do it for? You do it for actinomyces. And then the Jensen's modification is done for Neisseria gonorrhoeae. And over here, instead of safranin, for a secondary stain, you use what? For secondary stain, you use neutral red. Neutral red. Okay, so remember Jensen's modification is for Neisseria and you use neutral red, and Brown and Bren is for actinomyces. These are the two modifications of gram stain. Now let's discuss lots of viva questions which get asked. Who discovered the gram stain and when? Hans Christian Gram in 1884. Please remember this. It is, yes, Morrill and Preston is also done. Morrill and Preston modification is also done, and the Wiegert modification for the staining of the tissues is also done. But it's good to know if you remember it. Oh God, it's good to know if you remember it. Otherwise, it's all right. You can just remember the two questions. What other stains can be used? What other stains can be used? So safranin, dilute carbamazepine, or neutral red can be used instead of safranin also. So you can use methylene blue, you can use crystal violet, you can use safranin, dilute carbamazepine, or neutral red. ठीक है? Then which is the most crucial or critical step in the gram stain? You know it's the decolorization step, because under decolorization, what will under decolorization do? You have put less decolorizer. So the primary stain which was supposed to go away will not go away. That will get retained. So falsely you will make a gram negative bacteria look gram positive. And if you over decolorize, if you put acetone and you start talking to your friend and the acetone is now there for 20-30 seconds, now you have over decolorized. Now even the poor gram positive guys will start leaking out the primary stain. How much will they retain? Okay, so if you over decolorize, you make a gram positive look gram negative. So that is why decolorization is the most important step. Then what is the primary diagnostic importance? Why do you do the gram stains? So it provides a rapid presumptive diagnosis. Okay, so gram stain is not just performed on the colonies, it is also performed directly on the patient sample. So if you have a patient of meningitis, you simply take their CSF sample and you can put gram stain on their CSF sample. Therefore you can get you can presumptively within 2 minutes you can check whether some bacteria is present in the CSF. You need not wait for overnight for the culture results to come. So it's a rapid presumptive diagnostic method. It classifies bacteria into gram positive and negative. It determines their morphology and arrangement. So presumptively I can, if I'm seeing in a GPC in clusters in the CSF of a patient, presumptively I can say this is Staph aureus, and I can alert the clinician. Presumptively if I say see some GNBs, I can say that okay, this is an enterobacterial GNB causing meningitis inside your patient. Then an empirical therapy can be started. So that is called as empirical antibiotic therapy, wherein empirically gram positive spectrum of antibiotics or gram negative spectrum of antibiotics can be started. So presumptive diagnosis, empirical therapy, then certain fastidious bacteria which are very, very difficult to grow, but they can be visualized directly inside the sample in a patient's patient sample, right? So suppose a person is having streptococcal pneumonia meningitis. Now it's a little bit difficult to grow streptococcus pneumonia in the lab. So just by looking at the gram stain of the CSF sample, seeing those GPC in pairs with the flame shaped capsulated arrangement, I can tell the clinician that it's probably strep pneumonia and maybe I am not able to grow it in culture later on. Then of course your yeast such as candida, not every laboratory has the ability to grow fungi. So for them gram stain becomes very, very important, because directly they can look at the yeast or candida inside the CSF sample of a patient and then inform the clinician that it's probably a fungal meningitis. Okay? So diagnostic importance is for presumptive primitive identification. What happens if you skip the iodine step? So the crystal violet iodine complex will not form, meaning the primary dye will easily wash out during decolorization, causing gram positive to falsely appear gram negative. So in one line, what will happen? Gram positive will falsely appear gram negative. Why is heat fixation necessary? So the first step, even before primary staining, the heat fixation that you were doing, it kills the bacteria safely. First of all, you are safe, you are not going to get infected. Secondly, firmly adheres or fixes the smear to the slide. That is why it's called as heat fixation. So it doesn't wash off and preserves the cell morphology. Now, many students wrongly say that the mordant fixes the stain. Do not utter fixes. Fixes word is reserved for heat fixation. A mordant will not fix the stain. A mordant will only help the stain to get retained. A mordant will only help the stain to penetrate better. So the chemical mordant iodine in gram stain is helping primary stain to get retained inside the cell wall, whereas the heating in Zn stain is helping carbonyl fusion to penetrate deeper inside the cell wall of a bacterium. The mordant does not fix. Please have this caution. A mordant does not fix or fixate. Okay? Please remember this. Mordant does not fixate. Then, what is gram variability? So, you know there is gram positive, you know there is gram negative. What is gram variable? Gram variable is that some bacteria, they inherently show mixed reactions. That is, they stain gram negative even though they are structurally gram positive, such as actinomyces, clostridium, bacillus, and also some yeasts. So, they might have a gram positive type of cell wall, but somehow they behave weirdly and they start to look red. Sometimes they look blue. So gram variability is that you cannot rely that they will definitely give a gram positive or gram negative reaction. You have performed all the steps correctly, but still they have that inherent property of not conforming to rules. There was no process errors from your side, but still the bacteria ended up looking red despite being a gram positive type of bacteria. This is gram variability. Then there are some guys, yeah, why might a gram positive appear gram negative? One is over decolorization, then using an old or compromised culture where the cells have autolyzed themselves, then specimen exposure to cell wall active antibiotics like penicillins or lysozymes. In that scenario, the cell wall only is destroyed. So this mostly happens inside the patients. When you take a patient sample, a lot of times because of so much antibiotics, the bacteria, they lose their cell wall and they convert into L forms. These L forms will never be able to retain the primary dye, right? So they will invariably look gram negative only. So the possibilities where a gram positive can appear gram negative is you've over decolorized, you've used an old culture, the patient has taken so many antibiotics that the bacteria has lost its cell wall, or the bacteria has been phagocytosed inside a white blood cell. So now that you're staining, the cell along with the bacteria is looking red in color. Which organisms cannot be visualized or doesn't stain using the standard gram stain? You know, ki, please, Nature Beauty, this is not the place to ask these questions. This is currently a practical session of the second year MBBS students going on. Please write on the right forums and I'll see you in 2 years. All the best. चलो, which organism cannot be visualized or don't stain well using a gram stain? हम बोलते हैं ना कि gram stain is a stain of the poor people, बेचारा गरीब लोग. Then you have these बड़े लोग who will not care about gram stain. Who are these बड़े लोग? People with big degrees. Which is a big degree? MRCS. So you have the mnemonic MRCS. MRCS are the bacteria which do not take the gram stain. So first you have the guy which does not have a cell wall only. So if there is no cell wall, where will the gram stain go? Gram stain will not happen. So you have mycoplasma. Mycoplasma does not have a cell wall. That is why it will never take the gram stain. Then you have R for the rickettsial group, which are obligate intracellular bacteria. Then chlamydia, which is so small that for the longest time we thought that it was a virus. So that will also not take the gram stain. Then the spirochetes, which are so thin that no staining can help. So for them we have to do silver impregnation or we have to do the dark ground microscopy. Yes, MRCS, correct hai she. Okay, na? So MRCS are the bacteria which don't take the gram stain. Now these are the observations that you can have. Gram positive cocaine clusters will be Staph aureus. Gram positive cocaine chains will be Strep pneumoniae or Strep pyogenes. Actually Strep pneumoniae will be in pairs and it will be lanceolate shape. But don't worry, you are never going to get it in your exam hall. They will never give you Strep pneumoniae in the exam hall. Gram negative bacilli or rods such as E. coli, Klebsiella and Pseudomonas. Gram negative diplococci would be Neisseria. Gram positive bacilli with spores will be Bacillus or Clostridium. So you are never going to get these. The only two possibilities you have is to get this or to get this or to get this. Okay, nothing else you are going to get. इसमें भी you will only get Strep pyogenes, never Strep pneumoniae. ठीक है? Yes, you definitely have to mention long chain or short chain. Mention it. Long chain, short chain. Please mention it. Right? So now let's start talking about the culture exercises. The most important part of today's lecture, which is the culture exercises. So I am going to discuss 8 organisms. So there is a possibility that you might get a blood agar plate on your table. If you get a blood agar plate, you have possibility of getting 3 organisms. Either you get Staphylococcus or you get Streptococcus, or you can get a swarming Proteus. Okay, if you get a McConkey agar plate, you have four possibilities. Either you have a lactose fermenter, then it could be E. coli, or if it is mucoid colonies lactose fermenter, it could be Klebsiella. If it is a non-lactose fermenter, it could be Shigella or Salmonella. Difficult to tell from the culture plate. You have to make a motility or a hanging drop for these guys. Okay, then if you get a nutrient agar plate and it is showing you a green pigment, it is definitely Pseudomonas. Yes, ठीक है ना? चलो, so let's start talking about these one by one. So what is the possible history that you can get? See the history. 28-year-old man presents with painful pus-filled furuncle on his back. Culture of exudate on a nutrient agar nahi, ye blood agar hai, yields what? ठीक है? So culture yields this. Now you tell me what it is. So can you appreciate the beta hemolytic colonies and the golden color colonies of Staph aureus? Also, you know it's a pus-filled furuncle. So you can get a history of a breast abscess. You can get history of a psoas abscess, any kind of a localized abscess or osteomyelitis history. If you're getting in the paper, you know you're dealing with your Staph aureus. Then what do you have to always, first of all, you have to talk about what agar it is. So you will write that I'm looking at all of this at a 5% sheep blood agar. ठीक है, I am looking at all of this on a 5% sheep blood agar. Then you will talk about the colony characteristics. So you know what are the colony characteristics? It is E cube C square S square O. Yes, this is the mnemonic. E cube S square C square O. You need not talk about all of the elevation, edges, margin, phala dimka. All you need to tell about the major important colony characteristics. So what all can you see? Can you tell me what shape it is? It is a round circular shape. Can you see that it is elevated or flat top? It is definitely elevated dome shaped. Can you see some beta hemolysis? Yes, you can see a narrow zone of beta hemolysis around it. Can you see some pigment? Yes, I can see a golden yellow pigment of the Staph aureus. There is no particular odor, so don't comment upon it. What are the edges and margins? They are entire edges, entire margins, no roughness. These are smooth, shiny colonies, right? So you will write that I can see round, elevated, smooth, golden, yellow colonies with a narrow zone of beta hemolysis. These are the most important points that you will write. Other than this, if you want to write any extra points, you are free to write. Write there is no odor, write there is no entire margins, write anything else that you want to write. Okay, write it is a smooth consistency, write it, it does not matter, right? Then motility. For motility, you will do hanging drop. Hanging drop or cation hanging drop as a rule will be non-motile. So actually, let's quickly talk about hanging drop motility right here, right? So how do you perform a hanging drop? You take a slide, then you take a plasticine and you make a ring of that plasticine. Okay, make sure that this ring of plasticine is not too thick, not too thin. It is the appropriate size that when you put a cover slip on top, the cover there is at least 1 mm gap between the cover slip and your plasticine. Okay, so that your drop can nicely hang down from it. Then you take an inoculation loop. Please make sure to put the inoculation loop in the correct test tube which has been provided with you along with your agar plate. Do not take the broth of your padosi. Do not take a broth of your friend. Do not mix the broths. Make sure when you have heated the loop, you have allowed it to cool. Please allow the loop to cool. Heated and cooled loop. Okay, heated and cooled down loop should be put inside the test tube to take out 1 drop of the culture medium, and then you put it onto a cover slip. Now you put the cover slip on the desk. You take this slide with the plasticine ring and you put it on top like this, right? Now you press it, it has stuck. The cover slip with the drop is stuck to your plasticine, and when you invert this whole setup, you will see that there is the cover slip. From the cover slip, the drop is hanging downwards. This is called as the hanging drop. Now what do? You put it under the microscope. So you can see this is the cover slip, this is the plasticine at the bottom, and you can see this is the cover slip, this is the slide, this is the plasticine ring, and how how this drop is hanging from the bottom. What you have to focus on? You have to focus on the edge of the drop. So first of all, you will focus at 10x followed by 40x. Okay, first always focus on 10x and then you focus on 40x. At 10x, what will you first see? You will see that there is an edge of the drop which can be seen. Once you focus the edge, do not move the stage at all. Simply change the nose piece, change the objective lens. Once you have changed it, you will see that near the edge, you can see the bacteria. Please do not utter the words gram positive or gram negative while talking or commenting upon the motility on a hanging drop. There is no way in which you can tell that the organism is gram positive or negative on a hanging drop. The only way to tell a gram positive and negative is on a gram stain. I have seen so many students out of anxiety and trying to answer quickly. They say, oh, I see GPC, I see non-motile GPC. How can you see GPC in a hanging drop? You cannot. You can see non-motile cocci. That's it. You can see the shape of the bacteria, but you have not put a gram stain. How are you saying I can see motile GPC, I can see motile GNB? No, you cannot. You can only see non-motile cocci, you can only see non-motile bacilli, you can only see motile bacilli. That's it that you can see. Okay. So how will you write? You will write the observation. You will write that I can see motile or non-motile bacilli or cocci near the edge of the drop at 400 times magnification. ठीक है ना? That is what you will write. What is your interpretation? Your interpretation is either motile bacilli or your interpretation is non-motile bacilli or cocci, whatever, depending. Maximum you can comment upon the arrangement in chains and clusters, but you cannot talk about the gram reaction. Do not utter the gram reaction at the hanging drop, right? So you perform the hanging drop. So that is what you will write in the culture exercise also. So in the culture, the moment you get the culture plate, you have to write which culture plate you have gotten. Then you have to write about the colony characteristics of that guy. In the motility, you will say, I will see non-motile cocci near the edge of the drop at 400 times magnification. Then you do, so sub near the edge of the drop at 400 times magnification. Okay. Then you do a gram stain. On gram stain, what will you see? You will see gram positive cocci arranged in clusters. Arranged in clusters. Then further you will be asked what are the identification tests, right? So you will write that the identification test is, first of all, it is GPC in cluster on gram stain. Then you will say that this guy is going to be catalase positive. Then you will say that this guy is going to be coagulase, both tube and slide coagulase positive. Then you can say that based on this, I can make a presumptive diagnosis that this is presumptively Staphylococcus aureus. Okay, Staphylococcus aureus, right? Based on this much step, you could tell that this is Staphylococcaceae family. है ना? This is Staphylococcaceae family. And over here, you could tell that this is Staphylococcus aureus. Okay? So everything is supporting a golden yellow pigmented beta hemolytic colony which turns out to be non-motile gram positive cocci in clusters which are catalase positive. All this is telling you that this is Staphylococcaceae family. Then you further perform the coagulase test and both slide and tube coagulase came out to be positive. Therefore, now this is Staphylococcus aureus. And that is how you finish writing in each and every step. How to understand the difference between elevation, margins and consistency? Okay, so you're going to extend the class as she never able to understand what to write in elevation, have to mug it up anyways. देखो, अब ध्यान से सुनो मेरी बात. This is your culture plate, right? So we are looking at the cross section. We are looking at the culture plate from the side. Okay. This is the agar surface and over here you have your colony. ठीक है ना? You have your colony. Suppose this is the colony of the bacteria. This is a single colony of the bacteria. Now you're looking at it from the side. So this thing is called as the elevation. elevation. The wall is called as the elevation. So just imagine a cube. So if you imagine a cube, right, this height of the cube, height is what is elevation. So here also the height of the colony is what is the elevation. Okay, then you talk about margins. Now you have to look at it from the top. Now what are we doing? We are looking at this agar plate. So this was the side view. This was the side view. Now we are taking a top view. We are taking a top view. So in the top view, you can see that this is your colony. This is your colony, right? Now, can you appreciate what are the margins? These are round entire margins. Okay, these are the margins. Look at the circumference. This is what is called as the margin. So when you look at this side, it is the elevation, and this is the this itself is the edge also. Edge. The edge and elevation is the same. It is the 3D. It's the height. And the margin is what you look from the top. And when you see the circumference, that is the margin. Over here, you can see that it has round entire margins. Round entire margins. Okay. This guy could have also looked like this. If it had looked like this, then this would not have been a round entire margin. This would have been a friable, fibrinated kind of a margin. That is an elevation, that is an edge, and that is a margin. So if this is my colony and this is my agar plate, this side is the elevation and the edge. And from the top, when I'm looking, this circumference is the margin. What is consistency? I will bring a loop. I will bring a loop and I will try to touch it with the loop. When I take my loop above, does it pick up nicely? Does it stretch like a string of cheese, or is it hard and brittle to touch? That is consistency. So whether consistency is soft, whether consistency is mucoid, or whether consistency is hard and brittle. Okay, it is, yes, they all look elevated because the colonies that you're going to get are only of the 8 organisms. They are not going to give you a nocardia which is going to be brittle, etc. But you're going to get the mucoid consistency of Klebsiella. You're not going to get mucoid consistency of E. coli. You see, the Staph aureus has a dome-shaped colony, but if this was E. coli, it would have been like this. The colony of E. coli is like this. It has a flat top. It has a flat top. Okay, so the top is also, it could be curved like dome shaped or convex, or the flat, the top could be flat like that of E. coli. Okay, so that is the difference. So when you look at a dome shaped top, that is Klebsiella. When you look at a flat shaped top, that is E. coli. But so much is not required at your end, right? You can easily look at the plate and you can tell anyway. Since you asked, so I have explained. Please make sure to write in all of these headings. Now let's look at the next guy. 7-year-old child presents with high fever, painful swallowing, inflamed tonsils with a whitish exudate. Throat swab culture blood agar pe ye aaya. What is this? You know you're dealing with a beta hemolytic strep. Can you appreciate the pinpoint colonies with a wide zone of beta hemolysis around them? So this is how you differentiate. Many students get confused by looking at the agar plate that have I gotten Staph aureus or have I gotten strep? Okay, so this is going to be the difference. Your Staph aureus plate is going to look like this. You're going to have the golden yellow pigment and you're going to have this beta hemolysis, whereas Streptococcus is going to be very, very small. Look at the size of the colony here. This is the colony, and look at the size of the colony here. This is the colony. Okay, so the colony is bigger, colony is smaller. This is golden yellow with beta hemolysis. This is white with beta hemolysis. So this guy is your beta hemolytic strep, and this here is your staph. Okay, please look at these images, put them into your brain. There is going to be a slight difference between the two. ठीक है, चलो. So this is of course Streptococcus, especially group A strep, because this is causing sore throat or pharyngitis. This is the history of sore throat or pharyngitis. Of course, you're dealing with a beta hemolytic strep here. So what all things will you find? What is the agar? Agar is of course 5% sheep blood agar. What are the colony characteristics? You can see pinpoint beta hemolytic colonies with a वाइड जोन ऑफ बीटा हिमोलिसिस, ठीक है ना। मोटिलिटी क्या होती है इसकी, दिस इज ऑल्सो नॉन मोटाइल। ग्राम स्टेन यू विल सी जीपीसी इन लॉन्ग चेन्स, GPC in long chains. What are the identification tests that you will do? You will first of all write that this guy is going to be catalase negative, and being catalase negative, and this puts it into the beta hemolytic Streptococcus family. Okay, so this is a beta hemolytic Streptococcus. Then how will you differentiate between group A strep and group B strep? Boot camp and abs, right? So camp test and bacitracin sensitivity. So you will write boot camp. So group B is camp positive and group A is bacitracin sensitive. This is going to be negative, this is going to be resistant. Okay, so you will write this and then you will write that I can identify it as group A or group B Streptococcus. Done and done. Then you can get this plate. First of all, you have to identify that this is a McConkey agar. Right, McConkey agar. 32-year-old woman presents with dysuria, frequency and lower abdominal pain, and urine culture is showing you this. Yes, for urine culture you need clade agar, but in the exam they are going to give you McConkey agar. You know this is uncomplicated UTI. Most common cause is E. coli. Can you see the lactose fermenting pink colonies with the flat top and the shiny smooth surface, right? So this is your E. coli. What is the agar? Agar here is McConkey agar. McConkey agar. What is the colony characteristics? You can see round, smooth, shiny, flat topped, pink, meaning lactose fermenting colonies. Okay, lactose fermenting colonies. There is, of course, do not comment on beta hemolysis on a McConkey agar plate. Do not comment on beta hemolysis on a McConkey agar plate, guys. Do not write non-hemolytic. Many students, just to gain extra marks, they write non-hemolytic also. No, if it is McConkey agar plate, please make absolutely no comment only on beta hemolysis. Don't write non-hemolytic. No comment on beta hemolysis. ठीक है? Motility testing करोगे, so what will you see? You will see actively motile bacilli. And what will you see? You will see gram negative bacilli on the gram stain. Identification कैसे करोगे? It is a member of the Enterobacteriales family. So first of all, you have to put it under the back bracket of Enterobacteriales family. So you will tell the examiner that this guy right here is catalase positive. This guy right here is oxidase negative. It is a glucose fermenter. It is a nitrate reducer. And this guy right here on OF test, Hugh Gleason OF test, has given me both oxidative and fermentative reactions. So it is a facultative anaerobe. And you will say that based on these characteristics, I have found out that this guy belongs to the Enterobacteriales family. Now I have to further find out which tribe it belongs to and which guy this is amongst the Enterobacteriales family. So now I will say that on further I found out the IMVQ. Where indole, MR, VP, citrate and urease are what? It is indole positive, MR positive, VP negative, citrate negative and urease negative and TSI. On TSI it has given me A by A with gas and no H2S. Yes, depending on this. So based on the colony characteristics, based on the motility, based on so many biochemicals, I am now able to say that this right here is E. coli, Escherichia coli. Okay, and please don't write short forms, write the full forms. I have written E. coli, but you please write Escherichia coli in the exam. If you will write it in this exact manner, in this exact presentation, then your examiner is going to be very, very happy. Don't jump to conclusions, don't write haphazard and random biochemical tests. Please go in this order, that based on this, it is a member of Enterobacteriales family, and based on this, MVQ and IQ, it is an E. coli. Okay? Then next, you have gotten chronic alcoholic man presents with acute pneumonia, high fever, thick blood tinged current jelly sputum, and sputum culture में दिख रहा है ये. What can you see? You can see the dome shaped lactose fermenting mucoid colonies. Okay, so what is the agar? Agar is McConkey agar. Right? What is the colony characteristics? You can see dome shaped or convex mucoid, large, pink, meaning lactose fermenting colonies. Yes, motility is non-motile. Please, Klebsiella is non-motile. Right? Then you have gram stain. On gram stain, you see thick, short, and stout gram negative bacilli with a capsule. Okay, with a capsule. So you have like these thick, small, little guys, stout and short, with a capsule around them. This is what you see on gram stain. Okay? What are the identification tests you will perform? Again, first of all, you will try to put it under Enterobacteriales family. How will you put it under Enterobacteriales family? You know now. It is an Enterobacteriales family if this guy is catalase positive, oxidase negative, OF fermentation plus oxidation both. Then it is nitrate reducer and glucose fermentation positive. Okay? Then further, your MVQ and TSI. On TSI, this will give A by A with gas, no H2S. Then indole, MR, VP, citrate, urease. What is the reaction? Minus, minus, plus, plus, plus. And therefore, I know that this guy is Klebsiella pneumoniae. Klebsiella pneumoniae. Then examiner will ask you, why is it not Klebsiella oxytoca? What is that one biochemical that will show you tell you whether it is oxytoca? Indole. If this indole was positive, it would have been Klebsiella oxytoca. Oxytoca. ठीक है ना? It is Klebsiella pneumoniae because it is indole negative and all of these. Right? Done and done. Then if you get this agar plate, this is also McConkey, but now you're looking at non-lactose fermenting pale colonies. So high fever, abdominal cramps, and frequent bloody mucoid stools. What is happening here? Bacillary dysentery, and stool culture is showing you these NLF colonies. So all that you know right now is this is a non-lactose fermenting on McConkey agar. So what is the agar? McConkey agar. What can you see? You can see the smooth, shiny, pale, that is non-lactose fermenting colonies on the agar. Motility is non-motile. Non-motile. Gram stain, you see gram negative bacilli. Then again, first you put it under Enterobacteriales family. First you put it under Enterobacteriales family. So you will write all the points of Enterobacteriales. Then you will write MVQ. MVQ. You know Shigella is Mr. Shy. It is Mr. Shy. So it is only and only MR positive. Right? We remember Mr. Shy. Shy means Shigella. Yes? So MR is positive. It is Mr. Shy. Yes? Then what about TSI? TSI is telling you what? K by A. No gas. No H2S. This is the exact reactions of Shigella. Shigella. Shigella species. Then examiner will ask you, what will you do in order to, yes, Mr. Shai. Shigella is Mr. Shai. Huh. Then examiner will ask you, how will you do the differentiation of which species it is. So the fifth point that you will write is, after all of this, you will do serotyping. Serotyping. Serotyping has to be done after all of this to find out whether it is Shigella dysentery type 1, whether it is Shigella flexneri, whether it is Shigella soniae, what is it? Okay? So please do not forget to mention serotyping. Okay, and even in the E. coli question, they can ask you, if they give you a diarrhea ka history, in that you have to talk about serotyping, because it could be EHECO157H7 and the child can land up in HUS. Since this is a simple UTI case, you don't need serotyping, right? So please remember that for E. coli, if it is a history of diarrhea, especially in a child, then you must go for serotyping. Serotyping must be done to rule out EHEC O157H7, because then the child can land up in HUS. Okay, if the diarrhea history is given, right? So you are done with Shigella. Now the same culture plate, right? And same things you're getting. Mekong agar you're getting, colony characteristics you're getting same, motility you're getting motile, and gram stain also you're getting same, right? The only ways to differentiate is the history. You're getting 1 week history of step ladder fever, abdominal discomfort. What does the blood culture? This is a blood culture that they have performed in the first week of illness. Okay, na? So very, very specific and very, very good history has been given. In the first week, they have done blood culture, and on the Mekong agar plate, you can again see the non-lactose fermenting shiny colonies. What is going to be the identification? Again, you will put it under the enterobacterials first, plus what is the MVQ going to be? You know, it is indole positive, MR negative. Citrate is negative for Salmonella typhi. For Salmonella typhi, the citrate is negative, right? And then you will do, plus you have to write, I will do serotyping. Serotyping with Kaufman white scheme. You have to write this, that I will do serotyping with the Kaufman white scheme to find out which Salmonella it is. Plus, what will you get on TSI? On TSI, you can get 3 possibilities. Either you get K by A no H2S, or you get K by A streak of H2S, right? Or you get K by A abundant H2S. Abundant H2S. So what are the possibilities? If it is no H2S, it is Salmonella paratyphi A. If it is streak of H2S, it is Salmonella typhi. If it is abundant H2S, it is Salmonella paratyphi B, right? And then further you do Kaufman white scheme serotyping to find out which Salmonella it is. ठीक है ना? I hope it is understandable. Yes, these are very dirty looking notes, but I hope you're getting the point that I'm trying to make, right? Chalo. Then you have gotten a nutrient agar. The moment you get a nutrient agar and you see the green pigment, you know you're dealing with Pseudomonas, right? Pseudomonas. Anyways, chalo, हाँ. Bird patient develops wound infection, burn आया, wound आया, ear pus आया, meaning otitis media. The moment you see all of this history, you know you're talking about your Pseudomonas. ठीक है? Purulent discharge having sweet grape-like odor, bluish green purulent discharge. What else do they need to tell you? Even on the nutrient agar plate, you can see the pigment. So what is the agar? Nutrient agar. And always on nutrient agar you comment on pigment production. So you will see round, shiny, whatever, green, diffusible pigment producing and sweet fruity odor, right? then you know this is Pseudomonas. Guys, please understand something. The things that I am telling you are the best case scenario things. This is not a must. Please use your brains and please use your common sense a little bit. It depends and it varies from strain to strain, from college to college, from lab to lab. In some places, the Pseudomonas may not have a fruity odor. So if it is not giving a fruity odor, do not comment upon the odor. In some places, there might be slight differences. Probably the Staph aureus will not be golden yellow. So please use your brains, use your eyes, be alert. Don't say that, oh, ma'am has written everything, so I will go ratify and write everything as it is in the answer sheet. Okay. First of all, pay attention to the plate that you have gotten. Is there a fruity odor? If there is no fruity odor, don't comment. Just because it is Pseudomonas, it has to produce fruity odor. No. But if you do have the fruity odor, then don't miss out on it. Okay. I am telling you the best case scenarios. I am telling you the ideal scenarios because that's my job. You have to use your brain. That is your job. So please, in the lab, what irritates the examiners the most is there is no fruity odor coming, still you have written fruity odor. And then the examiners argue with you. I don't smell a fruity odor. You say, sir, this is Pseudomonas, so this has to give fruity odor. Now then the examiner gets irritated. Why have you decided that it is Pseudomonas? Who are you to decide that? Okay. So please go in a sequence, see what you're actually looking at, use your brain, and then write the answers. Okay. Don't just blindly follow the book. Don't just blindly follow my slides. This is the best case scenario which is possible. But you see what actually has been given to you and then you write it. Okay. Don't go with a preoccupied mindset. I will give you the one rule of performing well in exams. Examiners hate it the most when you go with a preoccupied mindset. Okay. They don't like it at all because microbiology and so many exams have been conducted so many times over the past so many years that everybody knows what is going to happen. Everybody knows these 8 organisms will be given. The students also know, the examiners also know. But it is always about that pretense of you not knowing and coming to the answer by yourself. When the examiner realizes that you have come with a preoccupied mind from home, that the moment I get a nutrient agar, it is going to be Pseudomonas, the examiner gets irritated. Then the examiners, they take it personally and they're like, what if I give you E. coli and nutrient agar? Then your poor second batch starts getting E. coli or nutrient agar. So be ready for all of these googlies. Be ready for anything in the exam hall. Okay. Yes, 90% of it is predictable, but you don't have to tell that you yourself had a preoccupied mind. Okay. Do not tell that to the examiner. Okay. Go with an open mind. See what you're actually looking at in the plate. So, fruity odor is very much circumstantial depending upon what you're seeing in your lab. Okay. Then motility, yes, of course, it has to be very, very actively motile with a single polar flagellum. When you do a gram stain, you see the thin GNBs. Now, will you first try to put it under Enterobacterials family? Yes, you will try. But will it pass? No. It will fail the Enterobacterials test. You will do catalase. It will come out to be positive. Then you will do oxidase. It will come out to be positive. Right? You will do nitrate. Okay, it will reduce it. No problem. Then you do OF test. And it will be only oxidative. Telling you that this is an obligate aerobe. Obligate aerobe. Yes, this will ferment glucose. Oh no, this will, and even glucose fermentation will turn out to be negative. So all of these things are telling me that this is not an enterobacterial, right? Not an enterobacterial. Right? Then what you will do? Let's go to the next page. Then once you've decided it is not an enterobacterial, you will see indole, MR, VP is of no use now. What is the most important thing now? It is an oxidase positive non-obligate aerobe. It is an oxidase positive obligate aerobe non-enterobacterial, and now you have done TSI. And on TSI you are seeing K by no change. K by no change. So based on it being motile, based on it producing a green pigment, based on the fact that it is a nil fermenter, based on the fact that it is not an enterobacterial, you can now say that this guy is Pseudomonas aeruginosa. ठीक है? Pseudomonas aeruginosa. ठीक है? हो गया? Done. Now finally you can also get Proteus. So either if the examiner wants to make your life easy, they will give you a blood agar plate on which you can see the swarming. If they'd want to make your life difficult, either you will get this or you will get a McConkey agar plate, and on that you're simply seeing some non-lactose fermenting colonies, no swarming, nothing. But here you can very much see the swarming. I hope you can appreciate the swarming. In the center they have made one single culture, and you can see how the organism has grown like this in concentric circles, right? So also catheterized patient develops complicated UTI, not responding to antibiotics, telling you that this is a multi-drug resistant organism, and urine culture is showing you this. Of course, what you're dealing with, you are the best. Thank you so much, Chiranjeevi. You guys are also the best. Chalo. Then you are dealing with Proteus. ठीक है? कौन सा agar था ये? This was blood agar. Colony characteristics. भाई colony ही नहीं है. The organism has swarmed all over the plate. So you can see swarming growth in concentric circles. Yes, swarming growth in concentric circles. First Viva question. At this point, what are your DDs? At this point, what are your DDs? Chalo, batao. You have, it could be Bacillus cereus. PPT on Mars. Bichara making PPT on Mars. Then it could be Proteus. It could be Vibrio parahemolyticus. It could be Clostridium tetani. It could be Serratia marcescens. Right? These are your DDs right at this is the short Viva question. The moment you get a Proteus plate with a swarming, short 1000%, one question examiner will ask you, what are your DDs based on swarming? Many students fail because of it. They say, examiner says, how do you know this is Proteus? You say, sir, it is swarming. And then they say, oh, if it is swarming, it is definitely Proteus. You think no other bacteria can swarm. You know, actually, these PPT on Mars are the guys which commonly show swarming. I'll tell you one thing. This is conceptual understanding and very few people get to know this. Any damn bacteria in this world can start to show swarming if I give it the right temperature, right nutrition, right conditions, or the lack of them. Okay? I can make an E. coli swarm in my laboratory, but I will not do that. Why do I want to complicate my life? Right? So swarming simply depends upon nutritional availability and production of swarm cells. Some bacteria commonly as a rule show swarm cells, and who are they? They are the bichara PPT on Mars. Which one are you going to get out of the bichara PPT on Mars? Proteus. That is why I said, don't go with a preoccupied mindset. It is definitely not that when a microbiologist looks at a swarming plate in lab, he straight away jumps to the conclusion that it is Proteus. Okay. So don't go with a preoccupied mindset. Go with a well-informed mind, wherein you tell the examiner, oh, I'm seeing a blood agar plate. I'm seeing some swarming. Based on swarming, it could be any of these guys. Now I'm going to further prove it, because also I'm looking at the history of the patient, wherein I see a complicated UTI in this patient, and when I did the motility, I found motile swarm cells, big swarm cells I found, and then on gram stain I found some GNBs. Then I did the identification test, and I found that it belonged to the Enterobacteriales family. It was catalase positive, oxidase negative, nitrate reducing, glucose fermenting, OF facultative, anaerobe. And then I performed the MVQ for this guy, and based on the indole, If indole is positive or indole is negative, I will find out the species of my guy, right? So it is as a rule going to be a urease positive guy, because urease positivity is prototype of Proteaceae family, right? And based on indole, I am going to say VIP, wherein vulgaris is indole positive. So if it is positive, it is going to be Proteus vulgaris, and if it is negative, it is going to be Proteus mirabilis. Mirabilis. Another biochemical which I have to say is this guy is PPA positive, and that places it under the Proteaceae family. Proteaceae family, and this further gives me whether it is Proteus mirabilis or Proteus vulgaris. Another point of distinction that you can add in all of these enterobacterials guys that you have seen, you can add this point that this is an enterobacterial and it is PPA negative. So being PPA negative, it can be any tribe other than Proteaceae family. Yes, so this excludes Proteaceae family, therefore it becomes E. coli. Same for Klebsiella, you can write that it is PPA negative. Now it has fallen out of the Proteaceae family tribe, therefore it belongs to Klebsiella tribe. Same you can do here also. You can say this was PPA negative. So now it has also fallen out of the Proteaceae tribe. यहाँ पे भी आप लिखेंगे PPA negative ताकि ये Salmonella tribe में जा सके. And यहाँ पे ज़रूरत ही नहीं है क्योंकि ये तो enterobacterial ही नहीं है. So we need not find out whether it is Proteaceae or not, right? And over here, since it is an enterobacterial, first you find out whether it is Proteaceae family. The moment it turns out to be PPA positive, you just have one thing left to do. Put urease, confirm it again, and put indole to find out whether it is Proteus vulgaris or whether it is Proteus mirabilis. And then you come to your sure shot diagnosis, right? This is the way your postgraduates write the exam. If this is the way you're going to present your answer, present in the answer sheet, speak in front of the examiner, nobody can stop you from getting excellent marks. Okay, this is the only way to present answers in microbiology. This is what we teach the postgraduates also. This is how we perform in the lab also. This is how your examiner thinks also. The moment in a patient sample your examiner sees a swarming plate, the first thing the examiner does is try to find out whether it is enterobacterial and then put a PPA test tube to find out whether it is a Proteaceae family or not. Then we look at the indole and then we come to the conclusion that it is Proteus vulgaris. Okay, so that is how the examiner is thinking. That is how you also understand the concept, and that is how you present it. Now you and examiner are aligned, there is no conflict, examiner's mood is happy, you're getting full marks. Okay, that is what we are trying to achieve with this. Chalo. Now we are done with such a huge chunk. We're left with only two things. Quickly we go over Zn staining, and then quickly we go over Albert staining, and we are done with the second part of your microbiology practicals. So with yesterday's spotters and with these two things, you're thoroughly, totally in totality prepared. So this was not even FARRE of practicals. This was a full-blown practical session. Okay. So let's talk about Ziehl-Neelsen technique, which is also called as Zn staining technique. Sometimes the examiners, they give you this moment of relief, wherein when you're performing really bad in exam or you're performing really well in exam, the examiner tells you just write the full spelling of Ziehl-Neelsen and I will pass you. Okay, so please practice. You might write the spelling of your own name wrong, but write the spelling of Ziehl-Neelsen right and you're good to go. Okay na? So write, practice the spelling of Ziehl-Neelsen. Sometimes this is what gets you passed in second year. I'm telling you, I'm not even kidding it, okay? I would do that if I was the examiner. If somebody was failing brutally, I would just tell them, write the correct spelling of Ziehl-Neelsen and I'll pass you, okay? Now, so what is acid fastness? Acid fastness means acid resistance. Acid resistance, okay? So you have certain group of bacteria who have such a type of a cell wall that they are resistant to most mineral acids. What are they resistant to? They are resistant to most mineral acids. Okay, mineral acids. So what are mineral acids? Hydrochloric acid, sulfuric acid, H2SO4, HCl. These are mineral acids. These guys are resistant to them. These guys have a very special mycolic acid layer in their cell wall. What is mycolic acid? It is like a waxy coating which is present in the cell wall of these bacteria. So you see the cell wall of the bacteria and you can see this thick yellow mycolic acid which is present. Now when you do Zn stain, you put a primary dye which is called as carbonyl fusion, which turns your slide red. Okay, now but this mycolic acid is going to prevent this carbonyl fusion from penetrating deep inside the cell. So what is that thing that you use for better penetration of the dye, guys? Mordant. What is the mordant here? It is heat. When you heat the slide, which is behaving like a mordant, this waxy mycolic acid dissolves. And when this waxy mycolic acid dissolves, your primary dye penetrates better into the cell and then is retained inside the cell, therefore turning the cell wall red in places. Okay, so this is the basic mechanism of heating. This is the basic mechanism of mycolic acid. Now, since their cell wall have mycolic acid, arabinomannan, galactomannan, all of this is making the cell wall very thick and resistant to mineral acids. So when we perform Zn staining, we appreciate or we find out the acid fastness of a bacterium or the acid resistance capacity of a bacterium against the stain. Okay, right? So you have all of this. What are the steps? The primary stain is the carbonyl fusion, and the carbonyl fusion contains phenol. So the question is asked that why are we adding phenol to it? I will come on to the Viva questions and I will tell you why are we adding phenol to it. Okay? We add the phenol, which is the primary stain. We do it for about 5 minutes. And while we have the slide flooded with the carbonyl fusion, we intermittently heat from beneath. Why are we heating from beneath? Because heat here is a mordant. The heat is going to dissolve the waxy mycolic acid coating and allow my carbonyl fusion to penetrate deeper and stain the cell wall of my bacterium, right? And till when do I have to intermittently heat? Till I see the fumes come out. Okay, do not boil it. Okay, I just need to see the fumes coming out. Once the fumes start coming out, I then put the decolorizer, which is again the most important step, and the concentration of the decolorizer, which is around 20 to 25% sulfuric acid, which I am adding. All the stain is coming out. Now I am adding the secondary stain or the counter stain, which depending upon your hospital, your college, your laboratory, it could be methylene blue or it could be malachite green. If it is methylene blue, ultimately your slide is going to look blue. If it is malachite green, ultimately your slide is going to look green. Till how much time do you decolorize? You decolorize until all color washes away. Okay, you decolorize until all color washes away. And then for how much time do you put secondary stain? You put it for about 2 to 3 minutes or 5 minutes. Okay, so you put carbonyl fusion for 5 minutes. You intermittently heat from the bottom till the fumes come out. Then you take that slide, you pour 25% sulfuric acid. You keep pouring it until such a time that all the color has washed away. Then you put the secondary dye. You keep it for 2 to 3 minutes. Wash it with water, air dry, focus under the 100x oil immersion of the microscope. ठीक है, आप 100x ऑयल इमर्शन माइक्रोस्कोप पे ये देखो, दिस स्लाइड इज लुकिंग ब्लू ग्रीन. यू विल फोकस इट एंड एट 1000 times magnification. What are you seeing? You are seeing these beaded red colored acid fast bacteria. So since the bacteria was acid fast, since the bacteria was acid resistant, so what happened? My Mycobacterium tuberculosis, who is resistant to 25% concentration of sulfuric acid, this 25% sulfuric acid was not able to do bigado anything of this bacteria. The bacteria did not get decolorized. So I took Mycobacterium TB on my smear. I poured carbonyl fusion. I heated it. The heating melted the mycolic acid of my TB bacteria. Carbonyl fusion penetrated deep inside the cell wall of my TB bacteria. Then I kept pouring 25% sulfuric acid. Nothing got wrong because this mycolic acid of TB is able to resist 25% H2SO4. It is acid fast. So the bacterium retained stained the red color of the primary dye. Then on top I poured blue and green colored secondary dyes, but the bacteria was already red with the primary stain because it was resistant to the decolorizer. Therefore, it will not turn blue or green. So only the background will turn blue or green, and against the blue or green background, I can see the red colored beaded bacilli of Mycobacterium tuberculosis, right? You will write the observation and the interpretation. Okay, what is the observation? I can see red colored, beaded, slender, curved bacilli against a blue or depending upon green background at 1000 times magnification. Yes, times magnification because you're using 100x oil immersion lens, right? What is your interpretation now? Your interpretation is that I can see acid fast, beaded, slender, long bacilli, most likely resembling Mycobacterium tuberculosis complex. ठीक है, this is your interpretation. समझे? Acid fast, beaded, slender, long bacilli, most likely resembling Mycobacterium tuberculosis complex. This is your interpretation. The moment examiner sees, what are you seeing? You jump up. Oh, I'm seeing TB bacteria. No, Baba. What are you seeing? You are seeing red colored beaded slender curved bacilli against a blue-green background at 1000 times magnification. What is your interpretation from that? That you are looking at acid fast beaded long slender bacilli most likely resembling Mycobacterium tuberculosis. Now a question examiner asks, why is it beaded? Why do you get a beaded appearance, right? So the answer is heating. It is the heating step because of which I am getting the beaded appearance, right? So you see, this is your bacterium. This is your bacterium and this is the big thick mycolic acid coating around your bacterium. ठीक है, ये था आपका, let's say a blue colored bacteria was there and it was surrounded by this thick mycolic acid coating. Now when you heated the guy, you created holes in this waxy mycolic acid coating, right? So these holes were created in this, and from these holes your red colored carbol fustian, it penetrated and it stained your bacteria in these places. Right, in these places your bacteria got stained. So ultimately what are you seeing? You are seeing this kind of a picture because of the holes which are created, and this is giving you the beaded appearance under the microscope. It is the heating in intermittent places from where the dye is entering that is giving you the beaded appearance of the bacterium. Okay, I hope you understood, right? So just to show you that these holes are created when you heat it, and from these holes this carbol fustian is going to enter and stain the cell wall in places like this. So that is why instead of seeing this one long bacterium, you are seeing these little holes which have been created. So these holes which are created is giving it this beaded kind of an appearance. All right, I hope it is clear now. This beaded appearance is because of the heating step. Chalo. Then the question asked is, tell me the RNT-CP grading. You have to by heart the NT-EP grading. Okay, you have to by heart the NT-EP grading of the smear. So it is not RNT-CP anymore. It is NT-EP, National Tuberculosis Elimination Program. Okay, क्या होता है इसमें? You have to, if it is a sputum sample, you have to find out how much is the bacterial load inside the patient. So there are no AFB in 100 fields. So you have to examine 100 fields inside the patient. How do you examine 100 fields? This is a glass slide एंड ऑन दिस ग्लास स्लाइड हियर इज योर स्मीयर, ठीक है, ये आपका स्मीयर है, इसके ऊपर है आपका बैक्टीरिया. सो यू फर्स्ट स्टार्ट फोकसिंग, यू फर्स्ट लुक हियर, then you move here, look, move here, look, move here, look. So you are moving all across the slide in a zigzag pattern like this. So once you have covered the entire field in a zigzag pattern, we see that you have seen 100 fields, examined 100 fields. Once you examine 100 fields on this slide and you see that there were there were no acid fast bacilli, then it is a 0 grade and the result is negative. Okay, you have examined 100 fields and you see 7-8 bacilli per 100 fields. So total in the slide, total in all of the 100 fields, a total count of 7-8 bacteria came. Then this is scanty positive. Okay, then again you screen through all 100 slides and you realize that total in all 100 fields, in all of the total slide, the total count of bacteria was around 90, 95, 96 bacterium in total you could see. Then your count is 1 plus positive. Then you started seeing the slide and you saw that in each and every field that you're looking, in each and every field you're finding around 7-8 bacilli, 1 to 10. Now you don't need to look at the whole 100 fields. Now you look till 50 fields and you say that okay, I have seen 50 fields and in each and every field I was seeing at least 7 to 8 bacteria. Therefore now this is 2 plus positive. And then you start looking in this another patient and you realize that in every field that I am seeing more than 10 AFBs. I am seeing 20, 30, 100 AFBs in every field that I am looking. Then you simply look at 20 fields and you say that okay, in each one of the 20 fields that I have seen, I could see more than 10 acid fast bacilli per every field. Therefore it is a 3 plus positive. So when you are writing, you tell the grade also. You tell the grade also. So depending upon what you are seeing, you tell the grade. So if every 100 fields, in total 100 fields you see no bacteria, 0. If in total 100 fields you see less than 10 bacteria, then it is scanty. If in total 100 fields overall you see less than 100 bacteria, 1 plus. In every field you are seeing 1 to 9 bacteria. After 50 fields you call it 2 plus. Every field you are seeing more than 10 AFB. After 20 fields you call it 3 plus positive. All right. All right, Talib, all the best for your exam tomorrow. Please focus on your exam. Okay? So please, I have really tried to explain it to you in great detail. I hope now finally the doubt of NTP grading is finished. Now, yes, you looked at a slender, beaded, long, curved bacteria. So you knew that, okay, I am looking at a Mycobacterium tuberculosis complex. What the examiner asks you is, what if it was Mycobacterium leprae? If it was Mycobacterium leprae, you would not have seen the long beaded appearance. First of all, in Mycobacterium leprae, you would have used 5% H2SO4 and you would have looked at short acid fast bacilli, right? And then what is the grading? This is an extra knowledge that you can do. The extra knowledge is that you can how to grade the lepra bacilli. One thing that you can tell, that the grading of leprosy is up till 6 plus, whereas the grading of TB is only up till 3 plus. The grading of leprosy is up till 6 plus. ठीक है ना? So now you have the modifications of Zdenstein which get asked in exams. So depending upon what percentage of sulfuric acid you are using as a decolorizer, you have different modifications. So Mycobacterium tuberculosis is 25% H2SO4 resistant. Leprae is 5% acid fast. Nocardia is 1% acid fast. The cysts of Cryptosporidium, hooklets of hydrated are 0.5% acid fast. The bacterial spores are 0.25 to 0.5% acid fast. Sperm head is 0.5 to 1% acid fast. And Legionella, Mick Daddy, Sapka Daddy, acid resistant constant is your 0.5 to 1% acid fast. ठीक है, it is not Legionella pneumophila, it is Legionella McDaddy, सबका daddy. ठीक है, that is acid fast, not Legionella pneumophila. All right, so you must memorize all of these concentrations that are used. Now let's discuss some very important viva questions which are frequently asked, and here are a few googly questions, so please pay attention. This covers most of the viva questions asked in Zn stain. So after Zn staining, what all can follow in questions? The anti-EP grading can follow in questions, which we have just seen. Why is it beaded? That can be asked. We have just answered that also. What is mycolic acid? We have just answered that also. Then they can ask who introduced the acid fast stain. You remember Paul Ehrlich ka CH was cheating because he got cheated. Paul Ehrlich was the guy who first discovered the acid fastness, but later your Zeal and Nelson, they developed the modern technique. That is why they have stolen all the credit by cheating on Paul Ehrlich. Okay, so Paul Ehrlich was the guy who discovered, but later it was modified, and the modern technique of all the steps that we perform, they were given by the Zeal and Nelson. That is why it is called as the Zn stain. What is the diagnostic significance? Because it is primarily used to detect AFB, most notably Mycobacterium tuberculosis and Mycobacterium leprae, and NTMs and opportunistic parasites such as Cryptosporidium and Nocardia. What is the structural basis of acid fastness? The cell wall of Mycobacteria has a very high concentration of complex lipids, glycolipids and fatty acids, जैसे कि mycolic acid, arabinogalactan and peptidoglycan. Therefore, this forms a thick, waxy, impermeable barrier that resists penetration by ordinary aqueous stains and even resists decolorization by acid and resists decolorization by mineral acids. And which mineral acids? Example, H2SO4 and hydrochloric acid. ठीक है ना? That is the answer for acid fastness. State the function of phenol in carbonyl fusion. Right? This is a very common question. That why do we add phenol in carbonyl fusion? The phenol acts as a lipid solvent. It lowers the surface tension and driving the red dye through the waxy mycolic acid layer. Right? So that is why when we perform the cold Kinune method, the cold Kinune method, they ask you, the question that the examiners ask you, what acts as a mordant in cold method? Because it is cold method, okay, you're not heating. So what is a mordant now? You increase the concentration of phenol. Increased concentration of phenol in strong carbolic carbon first chain. ठीक है? This increased concentration of phenol acts as a mordant in the cold or Kinune method. ठीक है? Please remember this. This is a distinction question. Very important. Very important. ठीक है ना? So that is why, what is the use of phenol? What is the importance of phenol? It also acts as a mordant. It also acts as a mordant. It also acts as a lipid solvent, which allows the dye to penetrate deeper inside the cell. State the function of Loeffler's methylene blue or malachite green. Why are we using Loeffler's methylene blue or malachite green? In fact, many students ask me this question, that they stain the decolorized non-acid fast bacteria and they stain the background cells, that is the macrophages and the neutrophils and all the cells which are going to come into the field, because TB is an intracellular bacteria also, so there will be a lot of neutrophils in that place. Which decolorizers can be used? So you can use sulfuric acid, you can also use HCl in ethanol. Please remember this, this is very important. You don't know this, you tend to forget this, you don't find this in books also. 3% HCl in 95% ethanol is also an acceptable decolorizer, along with 20 to 25% sulfuric acid. Okay, so this is very important for you to know. Extra knowledge that I have added to your brains. Chalo. Why is heat applied during carbon fusion? Steaming melts the waxy mycolic acid and allows the carbon fusion to deeply penetrate inside the cell wall, right? Because heating is a mordant. Heat acts as a mordant in this case. With precautions need to be applied while heating during carbon fusion. You do not boil, just heat until the vapors rise. All right. Then why might a known tuberculosis patient's sputum slide show a negative ZN result? Okay, if you have a known TB patient, how come the ZN can come negative at times? If you have done inadequate heating, or you have done over decolorization, or you are using an expired carbon fusion, these are the technical errors which can occur. Then there can be some biological factors, such as there is a low bacterial load in the patient sample. Now you are not able to read it because sensitivity is 10 raised to power 4 bacilli per ml is needed for you to be able to detect it in the ZN stain. So it is a very low sensitivity stain. Improper collection, such as patient has just given saliva instead of a deeply cuffed out sputum to you. In that scenario, it can come negative. Or the patient is already on ATT, and in that scenario, the bacterial load has reduced very low, and in that scenario, you cannot find it. So there can be technical errors and there can be biological patient related factors such as a low bacterial load. All right. Methods to make microscopy more sensitive. Tell me. The fluorescent screening method for AFB using auramine rhodamine stain allows for a much faster screening under low magnification. The positive results are typically confirmed with a ZN. Okay, so sensitivity is more with the fluorescent staining. So the examiner might ask you, how can you make this ZN stain better? How can you make sure that nothing gets missed out? You can say, sir, fluorescent staining by auramine rhodamine gives a much better sensitivity as compared to ZN. Okay? Lastly, we have the very last concept of today, that is the Albert stain. All right, Albert stain ko khatam karte hain. It's very, very simple. Just a few slides. Then we'll also discuss the questions related to Albert stain, right? So Albert stain kya hai? You simply have Albert 1 and Albert 2, that's it. There is no washing involved, there is nothing involved. There is no washing in between Albert 1 and Albert 2. You don't wash. You pour Albert 1, you pour Albert 2, then you wash, and then you look under the slide, which is green. When you focus under the microscope, you see the typical metachromatic granules and the Chinese letter pattern. So what are you seeing? You are seeing green bacilli in Chinese letter pattern, or V-shaped or cuneiform pattern arrangement. Cuneiform pattern arrangement showing the metachromatic deep blue or purple granules at the poles, right? So this is your observation. This is your observation जो हमने पहले लिखी है, जो हमने पहले पेज पे लिखी है. So what is your interpretation? Interpretation is that it is most likely resembling Corynebacterium diphtheriae. Most likely resembling Corynebacterium diphtheriae. What is Corynebacterium? Coryne word means that the shape, the club-shaped appearance because of the metachromatic granules. This is something what the slide is going to look like to you. You can appreciate the two ends are of the blue-colored bacteria with the green-colored bacilli. Yes. Then what are the constituents of Albert 1 and Albert 2? You get asked this. Okay. So Albert 1 is simple. You take iodine plus you take potassium iodide, and Albert 2 is finished. There are many components of Albert 1 which you get asked, right? So name the reagents in Albert staining method in exact order and state their functions. So Albert A or Albert 1 contains toluidine blue, malachite green, glacial acetic acid and alcohol, and Albert B contains iodine and potassium iodide. So this is easy to remember, iodine and potassium iodide. How to remember the constituents of Albert 1? So you know Albert 1 or Albert A contains too much gyan. Now by the end of 2 hours you're feeling, bhai, too much gyan ma'am is giving us today. We are going going to absolutely excel the exams, right? So what is too much gyan? T stands for toluidine blue. Toluidine blue. M is malachite green. Malachite green. G, glacial acetic acid. Glacial acetic acid. And A stands for alcohol. That is 95% ethanol. This is Albert A or Albert 1. ठीक है? That is too much gyan. Toluidine blue, malachite green, glacial acetic acid and alcohol. Now you have to answer each and every point. इसमें क्या है? Toluidine blue, too much gyan is happening here. Toluidine blue, metachromatic dye that stains the granules bluish, black or purple. What is malachite green? It stains the body of the bacilli green. What does acetic acid do? It acts as a weak fixative and enhances the dye penetration. What is iodine and potassium iodide? They are acting as a mordant. Okay, it fixes the dye complex, deepens the color of the granules and prevents the stain from washing out of them. Okay, so that is acting as a mordant. Then the next question they ask you, what are some other stains which can show these volutin granules or Babes Ernst granules, right? So what are these metachromatic granules called as? They're also called as Babes Ernst granules or volutin granules. Volutin granules. So other than the Albert stain, what other stains can be used? Mnemonic is plan. So you have the Ponders stain. Ponders stain. Then you have Loeffler's methylene blue stain. Loeffler's methylene blue stain. Then you have, of course, the Albert stain. Albert stain. And you have the Neisser stain. Neisser stain. Right? These are all the stains that you can use for volutin granule staining. Albert stain करेंगे तो what chemical are metachromatic granules made up of and why are they called as metachromatic? Very common question which get asked. So they are composed of polymerized inorganic polymetaphosphates, right? They are called metachromatic because they stain a different color. Metachromasia. Meta means different. You know, metaverse, metamorphosis, meaning a total change from the dye used, appearing bluish black or purple black when the bacterial cytoplasm stains green. What is the function of these granules? They are the energy and phosphate reserves or energy storage. They are nothing but the storage granules which the bacterium uses. Okay? So what specimen is collected to diagnose diphtheria? A throat swab or a nasopharyngeal swab taken beneath the grayish white pseudomembrane, ensuring the swab touches the bleeding margin, or you can also take a little piece of the pseudomembrane. Okay, what safety precautions must be taken? It is a high risk pathogen producing an potent exotoxin, so you wear gloves, mask and process it in a biosafety cabinet and ensure proper disinfection. Okay. So just to sum up everything, what was Gram stain's purpose? To do broad differentiation. TB, Zn was to detect either Mycobacterium TB or lepri, and Albert stain is specifically for Corynebacterium diphtheriae. Grams में primary stain is crystal violet, decolorizer is acetone or alcohol, counter stain is saffronin. Ultimately you get gram positive or negative, which is purple or red colored bacteria. Here you have carbon fusion plus heat, 20% H2SO4 or 5% H2SO4, methylene blue or malachite green, and you see the same pink colored bacilli against a blue field, which is the acid fast bacilli. Albert is Albert 1, which is too much gyan, toluidine blue, malachite green, glacial acetic acid and alcohol, and the Albert 2 is what is a decolorizer and what also acts as a mordant. There is no decolorizer and no counter stain used in Albert stain. Ultimately you see the green body and blue black poles of the bacterium with the blue black poles. We have already done the hanging drop, and that finishes off our session for today. Okay, so thank you so much guys for attending and for being consistent. You have stayed in the game throughout. All the very best for exams, and we shall celebrate soon. All right guys, so thank you so much for attending. That's it from my side. Please reach out to me on my social media if you have any doubts. Thank you so much. Bye bye. Good night. Take care.